Welcome to the Transforming Healthcare Coaching Podcast, where we bring you guidance and coaching perspectives so that you can level up in your life and work. Hi, everybody. Welcome to the Transforming Healthcare Coaching Podcast. And I am super excited today for our next in our series of guest interviews. This one is fresh, hot off the presses with Dr. Jessi Gold. And I just wanted to let you introduce yourself in terms of who you are, all your different roles. Could you talk a little bit more about you in the beginning before we get into your book?
I am Jessi. I'm a psychiatrist by training. I primarily see healthcare workers and college students. That's been my population of choice since residency, honestly. I also carry an academic title, so I'm an associate professor of psychiatry, and I teach and do that kind of stuff around that and write. But the bigger sort of role I have now is I'm chief wellness officer for the University of Tennessee system, which is all 5 schools of the University of Tennessee and the students on them. It is about 61,000 students now. And through that role, look at wellness as a central value for all of our campuses and what it looks like to kind of unify them and break silos and have conversations across the different schools, different offices, all of that. I also, you mentioned I have a new book. I've been a writer since med school as a way to reflect. And this is my first book. It's called How Do You Feel? It just came out on October 8th, but it's a lot of the same kind of conversation and things that are important to me, but in book, memoir, story form.
And would you be willing to share a little bit about how you chose with your career journey right after full training to actually focus on healthcare professionals? It's actually not common.
No, it's not. And I think it's also not seen as a specialty, right? So somebody would say to me, that's not a specific focus because it's not like I had extra training for that. And someone might also say that they're too high functioning, which is the thing I get too, that somehow people who can manage their work and be depressed doesn't mean they're not, somehow they think it means they're not depressed enough. But that's a frustrating word to me. For me, I've always been an observant human, and that has led me to question things along the way in my own training, starting as a pre-med and wondering why we did certain things and why the culture was a certain way and why everybody was mean to everybody else. And then I observed as I went along and said, oh, when people have mental health problems, they don't ask for help. What's that about? And then tried to find ways to be supportive once I was in residency, where I started group training that was both learning how to do groups and also doing support groups for med students. So I inherently was like, how do I now, with my clinical skills, try to fix these things that I've seen along the way? It grew substantially over COVID too. So I was in a place that didn't have a lot for faculty and staff yet. And I asked a question and I became in charge of it. And in so many ways also was doing psychiatry on the undergrad campus. And a lot of us got furloughed because of need, the students weren't there anymore. And we couldn't practice state lines and all sorts of things like that. And because of that, I said, okay, I know this stuff. Can I do this stuff? And so I started a clinic and helped grow a clinic for faculty and staff and their dependents that was funded by HR. And we had a lot of outreach and education central to what I was doing too. But that interest really grew and a clinical focus through the pandemic. I had done some of it, but not enough. And then I really ended up laying my head there since then.
Yeah, so when I came across you on LinkedIn, I actually really felt, oh, this is a person who you just want to, through the LinkedIn and through the videos, that you want to give a hug. Because who else would actually spend time worrying about us as healthcare professionals all along our journey and seeing all of the change and the hidden culture that we all experience, whether you're a physician, a nurse, a medical student, a pharmacist, NP or PA, our culture is a bit toxic. And as much as chief wellness officers do try to change the system, because we have to be grateful for the fact that people like yourself are trying at the highest systemic levels to change the system. It's a slow-moving glacier. And so it does take everyone's effort to try to be the voice of change. And so I'm curious, how does your daily work life look now as a chief wellness officer for a huge organization, a huge collegiate organization?
I respect that you said glacier pace because I do spend a lot of time in trying to understand when you're a person who can't control that stuff, what can you control? in a serenity prayer sort of way. If you're in a broken system, you don't want to quit and you can't leave and go somewhere else. Like, how do you thrive in that workplace anyway? And I feel like that is consistently something I'm trying to understand, because I think that people have long seen that as us saying they're not resilient enough. And I see that as, no, the system is broken. You don't need to be resilient. You just have to know how to tolerate it in a way that works for you. And for me, those are different things and different things to focus on. But from a system level, lots of meetings, lots of travel. There's 5 campuses, so I have to go to all of them, and I've done like trips to all of them. I do a lot of bringing people together across the system in meetings based on things that I find are an issue. So like substance use and prevention or something, then I'll grab a couple representatives from every campus to then focus on that issue and make that a working group issue. Bringing people together across the system, breaking silos, having like I formed 2 student groups for the same thing, because I've often felt like we do things to people but don't ask the people. And so as a clinician, we've long done that. And I wanted to do better in a role like mine. And so I had applications, and I have an undergrad council and a graduate student council, and again, meetings, but inherently they're like life-giving meetings. I love those meetings. They're so fun, and the students are great, and I learn so much, and they're so like excited about doing stuff and making it better. And that is important when you're in work that sometimes can feel like you don't see a connection to what you're doing. I have 3 graduate research assistants working with me on my team. I'm otherwise a team of 1, but it will grow eventually once I know what it needs to grow to. But a lot of what I'm spending time doing is understanding our baseline. What do we know about our mental health and wellness across all the campuses? What are we missing? What is everyone collecting? Can you compare any of it? And then at the same time, what is everyone doing? Because there's programming and education and stuff in all of these different sort of silos. But if you asked me, hey, Jessi, what are they like? How many of your schools use coaching? I would have to look that up or go ask all the schools if any of them had coaching, right? So it's not a built in like database of understanding that needs to be updated every once in a while. It's institutional knowledge. And it makes it hard to know where the gaps are or who's doing something well that can be amplified somewhere else. And I spend a lot of time trying to get to understand where we are so we can know what we need to be doing.
Oh, that's really great. It's also, I think it highlights the fact that this starts early. Some of the maladaptive behaviors and perceptions of things starts actually in college as you're trying to get into pre-nursing, pre-medical, all of the different science fields and the STEM fields. And then also just that stress of getting through college and becoming a young adult all the way into grad school and figuring out like what can you listen to, whether you have an advisor or a mentor or a sponsor who is going to give you all conflicting advice. And then add in things like racism and gender inequities. And you just have a possibility for you just don't know how to cope with all kinds of adulting
Yeah.
kind of things. And then it makes, of course, perfect sense when you're suddenly expected to be highly professional as a healthcare professional, that suddenly those other different experiences don't affect you at all. And that's not true. So I think it's really wonderful that you're really trying to get to the root cause and figure out where we need to go. And I think the biggest problem too, as you point out, is that all of us is, for example, like myself, we do a lot of well-being initiatives here at my healthcare system as well. It starts to become very lonely. All of us in our different little silos are bringing the community together. And it's great to see newer initiatives and newer conferences where there are actually people who care about clinician being from both academic conferences perspective, along with dissemination of knowledge that hopefully times will change.
Yeah, I'm glad you mentioned the taking care of our own bit. While my job focuses on students because it's just such a big population and scope wise, it would be bonkers otherwise. I made an effort to include also the faculty and staff who work in this stuff, like who do wellness or who are on the counseling staff or who are doing outreach. Because to me, they're not advocating for themselves, but it's a really hard job. And we need to make sure that we're helping them stay in their roles. I've often felt as like a psychiatrist who does like either college stuff or healthcare worker stuff that like people just assume the solution is like more of us. If we could just get more of you, and why is everyone leaving? I don't understand this sort of thing, but trying to get a better sense of what our work actually is like and how we're measuring it and how that's affecting us, I think is really important to building a healthy, sustainable workforce, which then matters to students like backwards.
Yeah, that's a really good, important point, especially for healthcare leaders and executives in terms of deciding, do I give a partial FTE and how many partial FTEs do I give out for these things? Because it does come back in rewards to actually have these initiatives Because even saving 10%, even if only 10% of your population actually utilize, those 10% were at risk for turnover. And if those 10% were people you didn't have to replace, the hiring costs are actually much they've already returned the return on investment is worth it. Because I know it does feel very challenging for many chief wellness officers and wellness leaders to prove that what they're doing works. And I'm also in the same struggle in terms of what is the right metric that I should be following. And I've actually gone more towards qualitative in terms of what are the actual stories. Because even one story prevented or one story changed is then hopefully a different story and a different leader that then moves on to a new workplace place or a new clinical environment and actually is not unwell.
Yeah. I think that we often have to tell the story and the things that people care about, which is money, not people. And that makes it really hard. We already know things like burnout costs systems billions of dollars and that depression's the major source of disability worldwide, but inherently it feels untangible. And I think that we have to understand how to make that argument to the people who care, leading from story to experience to money in some way that they can see it and value it. I wish they just valued the story and the person, but I think inherently, at least my experience everywhere I've worked, that you do need to understand what they're thinking about bottom line wise. I think things like recruitment and retention are really important things to focus on in these arguments because looking at Gen Z and Gen Alpha, if you don't have work life balance as a priority, these kids are not going to go into medicine. Like I wouldn't. And I think that they have a lot more awareness of not just doing something because of prestige or because that's how it's always been. And I think we're going to have a really hard time if we don't change or center it. And I'm like, hey, let's talk about the alarm bells of what the next generation values and where healthcare stands in this.
That's great that you said that because I actually think that next generation is already here. Having trained physicians for the last 18 years, my graduates are not willing to put up with some of the expectations that we did in our generation. And so I think having a lot more buffer for the teams that you hire, and that goes across all professions, whether you're a nurse, a pharmacist, or a physician, asking them to take on administrative roles and leadership would clearly have time requirements for both project completion and also leadership of these huge either research teams or quality improvement teams or education initiatives does require some wiggle room within both the clinical schedule and also their faculty benefits. And so I think that day is already here. We don't know when we're ever going to retire or be able to pass the baton onto others rising through leadership because they're just looking at the opportunity and the contracts and giving it a side eye because it doesn't meet the muster already, I think.
Yeah, for sure.
So, what I want to talk now more about your book, How Do You Feel, which, like you said, came out on October 8th. And what I really love about it is the fact that it talks about the many unspoken mental and physical burdens that healthcare clinicians carry. Would you be able to share just a small peek into one of the stories in the book for their audience?
Sure. One of the stories is mine, but I'll not talk about mine for the sake of not being a narcissist. But inherently, I think one of the ones that I hear a lot from people that resonates is there's a resident patient and he has obsessive compulsive disorder, like newly diagnosed in the setting of COVID. So germs everywhere. And a lot of what through him is the lack of redundancy in training, the stigma around mental health, and this fear of being found out, the struggles even taking time off when you need it because of what it means to everybody else, but also what it means about you. And I think that as a trainee, he faces like specific stuff that trainees face. For me, it was really important to pick people that represented different barriers and different experiences to the whole person. So there's a pre-med, there's a later seasoned attending, and there's a nurse. All of those are serving specific purposes to be able to talk about the issues that you face at every stage and how they're different. And for him, like you see a lot of this just fear of being discovered or what it means. And I think that resonates with a lot of people. It doesn't have to be obsessive compulsive disorder. I think in so many ways, he says something about how depression and anxiety are fine, but anything else is not. And that always resonated with me. So they're composite patients. They're based on interviews plus multiple patients instead of just one patient for privacy reasons and also just my own relationship with my patients wise. But I think the idea of us maybe being at a phase where we've normalized at least basic major depression and anxiety, but we judge these other things differently. I think suicidal thoughts are up there. I've had friends who have more severe depression and feel like that's not as understood in our workplace. And so I think it's a important conversation around, okay, maybe we've moved the needle a little, but what about the rest of them? And are we really fully capturing a picture of what mental illness means in healthcare? And how do we feel safe to get the help we need and ask for the help we need when we're repeatedly viewed as a burden for doing so? And I think his story, his experiences, the things that he struggles with, a lot of people experience in different workplaces too, like not just healthcare. And so can resonate with feeling like that and not knowing what to do. And maybe how I help him is helpful for you too.
Thank you so much for sharing that story. And I think it just goes to along the ways of many leaders and many groups want to actually have foster belonging and inclusion and diversity. Well, we think traditionally about it being like gender or ethnic culture or diversity in race. It's actually also diversity in other, whether it be physical or mental challenges you may have faced or have ongoing, or you're just neurochemically different. And so the question is, can we allow any other kind of expression within our workplace and actually celebrate it? It's really challenging, I think, for different ways of perceiving the world to be actually seen in the normative society of the way we practice healthcare currently. And so I think your story brings up, like you said, you can interchange and put fill in the blank what it is you don't feel seen, and that you also have invisible stories you've told yourself about that you can't take the time to get this taken care of, which I think is the hardest burden when you have improperly or incompletely cared for mental or physical challenges. And I think what's also interesting about the stories in your book is that they evolve over time in the book, because that is actually a really, I think to me, a really great lesson about life and learning and also healing and understanding. You're not going to just snap your fingers. Everything's okay after you saw the psychiatrist. It actually will be an ongoing learning and recovery process of trying to understand yourself. And I really enjoyed that about this particular aspect of there is hope. So for all the people in training out there, there is hope and it is a process and you can find the people to support you. That's pretty clear in your book.
Yeah, hope is definitely a process. I said, I talk a little bit about how certain types of therapy can make things worse before they make things better. And I think that scares people, like trauma therapy or exposure, what you would use for OCD, can make you a lot worse before you get better. But it has evidence it works. It can make a difference. You just have to get through it. And avoiding it only works for so long. And I think in having people come back multiple times and have different conversations. Like that's my job realistically. Obviously the timeline's a little condensed because not everybody's like perfectly coming back every month and stuff like that. But I think that inherently I learn new things about people every time I talk to them. They're having new life experiences every time too. And I practice psychiatry very much as a psychotherapist, which not everybody does, but where to me, yes, there are meds. That's part of it. There are not enough of us prescribing meds. So I have to be a person who prescribes meds, but I can't drug the pandemic out of you. I can't drug the way racism out of you, right? These things that are inherent big, complex cultural issues or big, complex world events or big, complex life events. And being able to understand and sit with some of that with folks and not just assuming adjusting a med is going to be the answer and being open and honest and realistic about what my role is in these situations, I think is also helpful. I would hope that people listening would also appreciate that it pulls back some of the layers about psychiatry. I think in a lot of ways we have a bad reputation, maybe as people who just like drug you and say bye. But I think it shows more of what we really do. And hopefully in humanizing healthcare, it also humanizes psychiatrists and makes it a little less scary for people to go that route if that's the right route for them. Because I take meds, lots of people take meds. It's a thing that really helps people. It's a tool, another tool in the toolbox. And if you're terrified of it because you think we're the worst people ever, like that's just another barrier in the complex system of barriers.
That is so true. As coaches, we often find that health professionals don't want to ask for help from a coach. And I can imagine, even though we try to explain that it might improve your performance, prevent burnout, or increases your well-being, I'm sure you get the same sorts of things, obviously, with therapy. And so how do we begin to change that narrative together in healthcare? Because I know that you and I both believe that one person at a time will be able to change the way we have constructed the maladaptive system, and we'll be able to strengthen our own personal abilities to thrive actually in a life, in a career in healthcare. So I'm just
Yeah.
curious, like how we can break down that barrier about asking for help and guidance.
Yeah, I think people are scared of things that they don't know, and they're also scared of things that people talk badly about. I think both of those things make it hard. So if you have somebody further along in training than you who says that asking for help can take away your license in some capacity, you're not going to be very excited to do it because they told you that it could affect your job and your identity in your life, right? If you have never heard of a coach and don't know what they do, you might be like, what's the point of that? And I think sometimes, like, people who have MDs, I'll speak for experience, like, sometimes are a little elitist about what people are doing and what it means. And they can be a little bit snobby about needing to go to another MD because I've had that experience. I've had that experience even doing outreach where I want to talk and I have a therapist on my team or something, and they would rather have me come because people will listen to me more because I'm also a doctor. And I don't know that's true, but they inherently believe it is. And I think that sort of belief of there's an in crowd also makes it complicated. Even speaking about it as the in crowd is like bad, but inherently being a person who's somehow not exactly in the in crowd, I think that they don't understand how that fits. I've heard a lot of leaders talk about coaching as like a leadership thing, but less on the wellness perspective. And I think some of that is also just not a lot of people have exposure to coaches and not a lot of people have that level of care. And I think we often wait until they're sick enough to come see me because that's when they're paying attention to themselves in the equation. And so it's also like a culture of shifting to prevention. And I think that that's like a problem in all of healthcare. I mean, we're like everyone goes to ERs, right? Like that's our system. We're just treating the disease. We're not stopping it from coming. And so I think a lot of these steps along the way, even therapy, don't have to be steps that are crisis steps or steps that you only take when you absolutely have to. But people show up in my office all the time and they say, I didn't hurt a patient yet, so I'm good. And you're like, that's a bar. Like, this shouldn't be the bar, but it seems to be a common bar, right? And so I think in that setting, it also, people might not even think about other options because they didn't think about themselves until they were pretty sick and they don't have other options. I think that's also a problem. So it's a lot of educating, exposure. I think people, when they have friends that have done something, are more likely to do it. So I think like if your friend had a coach, they really liked the coach, they would recommend that coach to you. It would be like a thing like that. I've seen that happen for leadership coaching. And I think that can get through. It's just exposure, explaining it, understanding what it's for, understanding how we don't only need to take care of ourselves when we hurt people. I think all play into this kind of concept of approaching this differently.
Wow, those are really amazing, great nuggets of wisdom in terms of the fear-based way that humans may actually wait until it's really that bad before then they'll think about not trying to figure it all out themselves. And yet so much of all that we do is like collaborations and communities that actually learn and grow together. And so I do really think it's wonderful that hopefully over time, the wellness prevention and the leadership actually putting infrastructural changes like chief wellness officers. I think there's not a single healthcare system that doesn't have some kind of attempt now at this point, either a nursing or physician level, to try to look for chief wellness officers. Hopefully, these communities will continue to grow and that our message will continue to get out there between lifestyle medicine and mental health advocacy and access and normalization to coaching and prevention and well-being. Hopefully, this will be a different day for our children when they actually become healthcare professionals too. Thank you so much, Dr. Gold, for being on our podcast. And we're really grateful to be able to highlight your work and all that you do at the University of Tennessee. They're really lucky to have you thinking and studying and trying to move the needle forward. We need to go generationally to improve things. So do you have any concluding thoughts you'd like to share with our audience today?
Yeah, my concluding thoughts are like check in on yourself. Your feelings are normal. Don't judge yourself for them. For some reason, we were taught they're good and bad feelings. There's no such thing, they're just feelings. I also think it's important for people to start to view like having big feelings or burning out as not a failure. I think that I long for my life, half the book's a memoir, so you'll see that, but have really viewed if I just kept going, if I just did all of the things I was supposed to do, if I was really good at this, it wouldn't affect me. And I don't think that's how we should be looking at this stuff. I think we should be looking at it like our jobs are really hard. We see really hard things. If we're doing research plus writing plus seeing patients, that's going to be a lot. All of that should burn us out, could burn us out. And we should approach it like, how do I better deal with it if and when it happens? How do I not blame myself for it when it does? How do I step back if I need to when it does? And I think it's really important to do that reframe. And it's something I'm still working on, which is like, this can and will happen. It's not magical that it does, and it's not a failure that it does, but it does require you to focus on yourself and take care of yourself in that context and make it better before it's worse.
I love that. And I really do think that, like you point out, it all will come back to if you have awareness. Once you have awareness, then you actually have ability to sense the data that's coming towards you and then readjust and repivot, because we are resilient, amazing people, and we actually can do great things. And it's just about being able to do the right thing at the right time and listen to yourself. So where can they get a copy of the book, or where can they see your next stop on your book tour?
Thanks for asking. So book is available anywhere you get books. Cheapest is going to be the websites that you think it's cheapest on, but supporting local bookstores is also great. So if you have one that you really like, just ask for it. They can order it if they don't have it. Like, the asking actually helps me too. If you read it and you want to tell me how you felt about it, I'm on social as at Dr. Jessi Gold about most platforms. And I like to hear from people about their experiences, and it makes me feel good about what I do to get that feedback. So if you want to, that's cool. My website is drjessigold.com. That will have tour dates, if you want to call it a tour. It will have places that I will be, and you can come say hi. I go most soonest to St. Louis, outside of San Francisco, and Ann Arbor. But hopefully, if people are listening and that's where they are, they'll look into where that is and come say hi and see me, because I do think you and I talk too about the power of having these conversations to change stuff. The thing I most like about book stuff, that even if it's not like making me money, because that's silly, is that it is a place to start conversation. And I get a lot of hope in those rooms because it's full of people who want to have that conversation. Maybe they're frustrated by it, and maybe they haven't been heard before, but they're in there because they want to have that conversation. And to me, then they'll bring that back and try to have that conversation. And so it's a bit of a like hopeful domino.
I love that. The hopeful domino. And I agree with you. For anyone out there listening who has any type of leadership position, directorship, executive leadership, or chief wellness officer investment, or all the little wellness soldiers like myself out there, get the book. Take a look. It really actually is a very easy read to help begin the conversation, because it's through the conversations with the people that we support. That's actually where it all begins. Thank you so much, Dr. Gold, for coming on our podcast, and we look forward to seeing you on all the socials.
Thanks for having me.
Thanks. Bye-bye. Thank you so much for listening to the Transforming Healthcare Coaching podcast. If you found this episode interesting or useful, please share it with your friends and colleagues in healthcare. And we would love it if you hit subscribe so that you never miss an episode. We want to help with the topics and problems that you want us to talk about. Leave us a review wherever you listen to us, with suggestions, feedback, and praise. It means so much to us, and we actually read every comment. For deeper support in your life and work as a healthcare professional and leader, head over to transforminghealthcarecoaching.com. Download our free 5 reflection questions to jumpstart your journey, and join our email list to be the first to know about our coaching programs. We're also excited to offer the MedThrive community, a supportive space for group coaching and self-paced personal growth, providing an alternative path to growth beyond one-on-one coaching programs. Find out more and join this thriving community at transforminghealthcarecoaching.com. Together, we can transform healthcare, one person at a time.